In other news, the Centers for Disease Control and Prevention updated its COVID-19 guidelines, not to state the pandemic is over, but to lead us to a point where the virus no longer affects our daily lives.
The key message is still to stay up to date on vaccines and new ones as they become available to avoid hospitalization and serious illness. KITV4's Shanila Kabir spoke with local health experts about the new guidelines and what they mean for Hawaii residents. Shanila.
Mika, I spoke to two doctors who had different responses to the new CDC guidelines. One doctor said the CDC is confusing the word caution with disruption, that 78% of the country remains in high-risk community levels. And another doctor who said we have to shift our focus to staying safe but practical as well. Dr. Scott Miskovich said the updated CDC guidelines are too broad and will confuse the public. In order to protect the kapuna and the high-risk population here, he said he had hoped the CDC would change the definition of fully vaccinated. 2 shots is 2021, and 3, potentially 4 shots, is maintaining immunity in 2022.
Once again, very disappointed with the CDC guidelines. They send the wrong message to the population of the United States. And even though they might say, well, the pandemic's not over, everything in these guidelines is basically giving the message to the people of our country to don't worry about the pandemic.
The updates include wearing a high-quality mask for 10 days and getting tested for COVID on day 5 instead of quarantining after exposure to the virus.
5 days of quarantine after being positive is only going to identify about 50% of the people who will not still be shedding. We were hoping they were going to extend the positive quarantine to 7 days.
Another key measure in this update, dropping social distancing, focusing more on staying up to date on vaccines, and isolating yourself when needed.
There are many layered mitigation strategies that can reduce your risk of COVID-19. Distancing is not the only one. In some situations, it's not the most practical way to protect yourself.
Dr. Sarah Campbell stresses the difference between isolation and quarantine. Isolating is when you feel sick, and quarantining is for when you know you've been exposed. Isolation is always recommended. And she says she believes COVID-19 cases will continue to go down in Hawaii, but they can always go up or down based on people's behavior. Shanila Kabir, KITV4 Island News.